Assalamualaikum and hello, we are from Group 5 and we'll be sharing about the radiation dose and biological effects which are deterministic and stochastic. Here are the group members for Group 5. The overview of our presentation is like this. Firstly, we'll take a look at the introduction and we will differentiate between stochastic and deterministic effect. After that, we will see the relevance of these concepts used in patient risk assessment, and then the medical applications. And last but not least, the safety measures and recommendations. Did you know radiation is a powerful tool in modern medicine, from imaging techniques like X-rays and CT scans to life-saving treatments like radiation therapy? Its ability to interact with human tissues help us detect and treat diseases more effectively. However, radiation also comes with biological risks. To manage this risk safely, especially in clinical settings, it is important to understand the two main types of biological effects, which are deterministic and stochastic. So, what are the differences between these two biological risks? Deterministic effects have a threshold. They only occur if the radiation dose exceeds a certain level. Once that happens, the severity increases with dose. Examples include skin burns, cataracts, and infertility. On the other hand, stochastic effects have no threshold. Even a small dose can cause them, but only the probability increases with dose, not the severity. Common examples are cancer and heritable mutations caused by random DNA changes. In radiation protection, this distinction is crucial, and we aim to keep doses below the threshold for deterministic effects and as low as reasonably achievable to minimize stochastic risk. So we'll see the relevance and so much more later.
I will explain to you about the relevance in patient risk assessment. So what is actually patient risk assessment? This is actually a systematic process of identifying potential factors in clinical environments or medical procedures that could cause harm to patients. Next to the deterministic effect. So deterministic effects are predictable and only occur when exposure exceeds a specific threshold. So if it exceeds, it will cause the skin burns, the tissue damage, and also the cataracts. We can know by that. So how can we actually minimize this risk, right? So there are several ways. We can use sophisticated planning software, which is nowadays there are a lot of very high energy software that can be used because it will actually measure the radiation very perfectly. So next is to employ shielding tools to protect healthy tissues. So there is a real part of our body that really fragile that we need to shield them so that they didn't need to be exposed by the radiation, and also to maintain and calibrate medical equipment very regularly. So this is very important because we want to make sure that the machine is in a tip-top shape. We have to train the staff very well so that everyone knows what they're doing, because this is a very high risk field, right? So everyone must have the knowledge. And also we have to adopt the new technologies that lower radiation doses. Moving on to the stochastic effect. So it is a probabilistic effect with outcomes that cannot be predicted in individuals. So this is very sneaky because we didn't know how the amount of cancer that can cause problems. It's like rolling a dice. It's about the chance, not the certainty. So the higher the roll, which is the higher the radiations, the higher your chance of trouble. Okay, so example that we can know that the effect that been there is by the cancer induction from diagnostic imaging, which is from the CT scans. So what are the ways to reduce this risk? So first is limit the unnecessary exposure, because the higher we expose the radiations, the higher the chance is, because we don't know the specific threshold that can cause problems. So it is just nice to just limit the unnecessary one. And the second one is we have to apply the lowest possible effective radiation dose. So it is similar, right? So we have to just expose them with the dose as low as possible. And the third one is ensure radiation is only used when absolutely needed. So we have to use the radiation when it's really needed. We cannot just expose them without a very specific reasons. And also by using advanced imaging and imagery technologies, because there are a lot of more technologies these days. So I will pass to the next presenter.
Radiation in medical applications.
So radiation plays a crucial role in the modern medicine. Radiation is important in medicine in two ways. The first one, diagnostic applications. Second one, therapeutic applications. So firstly, let's dive in through the diagnostic applications. Diagnostic applications involves using radiation-based techniques to visualize the internal structure and function of the body, enabling early detection and accurate diagnosis. So some of the examples of using radiation in diagnostic applications is using, as known, computed tomography or CT scans. CT scans provide a detailed 3D image of organs and tissues. So this is crucial for diagnosing the conditions such as cancer and internal injury. Second one, which is mammography. Mammography specializes in early breast cancer detection and nuclear medicine imaging. Lastly, fluoroscopy. Fluoroscopy offers a real-time imaging for guiding surgical instruments and studying organ functions. Second way of using radiation in medicine, which is therapeutic application. So radiation therapy targets and destroys detailed diseased cells, such as external beam radiation therapy, or as known EBRT. EBRT works by delivering high energy radiation from outside the body to target and destroy cancer cells. The process begins firstly with the diagnosing using CT scans or MRIs, and then secondly, locate the tumor and plan the treatment. Thirdly, the patient should be positioned on the treatment table, and machine called linear accelerator will use to direct radiation beams from different angle to target the tumor. So that would help us to save the health tissues from unwanted radiation.
Move on to the next slide. I will talk about what is safety measures and recommendations should be taken when we face the radiation risk. So the risk includes the deterministic effect and also the stochastic effect. So first of all, let's talk about how to control the deterministic effect. There are three important things. The first one is focus on keeping radiation doses below critical threshold. So for deterministic effect, safety precautions are designed to keep radiation doses from exceeding specific threshold. This includes establishing rigorous dose limit, especially to people who work in radiation-related fields such as medical imaging, nuclear energy, and also the research institution. And second, regulatory agencies such as ICRP or International Commission on Radiological Protection recommend that occupational exposure should be limited to 20 millisievert per year, that average over 5 years, and maximum of 50 millisievert in any single off-year. These restrictions are served to prevent acute health impacts such as skin burns, radiation sickness, and also the organ damage. And then, for the protective strategies, the use of shading material like lead and concrete to be as an additional protective measure. The second one is to reduce the time we spend from near of radiation sources. Next one is to increase distance and use the remote handling tools. And lastly, to monitor exposure with personal dosimeters. Workers are typically equipped with dosimeters to monitor accumulated radiation exposure and ensure it remains with acceptable limits. In terms of minimizing stochastic effect, which are generally associated with long-term consequences like cancer and genetic mutation, there are no guaranteed safe doses, but we are focused on reducing the risk rather than prevention of a specific outcome. And since there is no threshold dose below which these effects are fully absent, and then alarm principle is crucial for radiation protection, which only keep exposure as long as reasonably achievable. And this principle helps to reducing radiation doses to the minimum necessary for achieving the intended purpose, such as obtaining diagnostic image in healthcare or conducting scientific measurement. So what are the best practices for minimizing stochastic effect? So the first one, to justify every radiation procedure to only use when benefit outweigh risk. Second one, to choose non-ionizing alternative like ultrasound and MRI when suitable. And lastly, to optimize imaging parameters and use advanced technology to limit doses. There are also ways to strengthen the safety practices. So education and continuous training to all radiation workers. Second, workers should have clear understanding of protection measures and prepare for any emergency actions. And lastly, credit safety audits and adherence to international and national regulations ensure that safety measures stay aligned with the latest standard and effective.
Okay, quiz time. So the question is, a patient undergoing radiation therapy experiences skin burns after receiving a high dose of radiation. Which characteristic correctly explains why this outcome is classified as a deterministic effect rather than a stochastic effect? So here are the choices A, B, C, and D. So maybe you can pause this video before we give the answer. Okay, 3, 2, 1. So the answer is B. The severity of the effect increased with the radiation dose. So why this is the answer? This is because deterministic effects like skin burns, infertility, and cataracts only occur once a threshold dose is passed. So after crossing that threshold, the severity of the effect becomes worse as the dose increases. So here are why the other options are wrong. So that is all from us. Thank you very much for watching and see you soon.